Hmm.
Welcome back to another session of Cancer Care at American Oncology Institute. Today, we are going to discuss about basic doubts of cancer. Here we have Dr. Anbu, radiation oncologist. Sir, welcome.
Thank you.
So, today we have some doubts about cancer.
Yes.
So, what is cancer, sir?
So first let's start with the very basic question, what is cancer? So cancer is a diseased state which is characterized by uncontrolled proliferation of a group of abnormal cells. So these cells have the ability to divide at a very fast manner and in an uncontrollable manner, and the uncontrolled proliferation of these cells will lead to the development of a tumor or a lump. So this tumor has the ability to infiltrate into the nearby normal tissues. Also, these abnormal cancer cells have the ability to invade the lymphatic system or the blood vessel system to spread to the different distant organs of our body. This process is called as metastasis. And why these cells are getting, how these cells are getting abnormal and how these cells are getting the potential to divide in a very fast manner. As we all know, the cell is the basic structural and the functional unit of any living organism, whether it is a human or an animal or plants or bacteria or viruses. So these cells, they have a cell membrane. Inside the cell membrane, they have the cytoplasm. Inside the cytoplasm, they have the nucleus. And within the nucleus, we have the genetic material, which we call as a DNA. So any abnormal changes that takes place in the DNA is called as mutation. So it is the mutation of the critical parts of the DNA which leads to the abnormal capability of the cells to divide in a very fast manner.
Sir, could you please explain us the causes of cancer?
So, cancer, the answer to this question cannot be said in a single word because cancer is not caused by a single agent. For instance, if we took the tuberculosis disease, which is caused by the infection by Mycobacterium tuberculosis organism, or if we take a AIDS disease, which is caused by infection by HIV virus. It is not so the case with a cancer disease. So as we have seen already, any agent that leads to the mutation of DNA can lead to the development of cancer. And these agents are called as the carcinogenic agent. So since the agents that can lead to the development of cancer is multiple, cancer is a multifactorial disease and it is not caused by a single agent. Since multiple factors can lead to the development of a cancer, they are called as the risk factors and not the causative agents. So some of the risk factors that leads to the development of cancer are the carcinogens that are present in the smoking, like cigarettes and BD. Also the carcinogens that are present in pan masalas, gutkhas. Other risk factors are alcohol consumption is a risk factor. Other risk factors next to these smoking and alcoholism are the exposure to high amount of ultraviolet rays which is present in our sunlight. Other carcinogenic agents are the chemical carcinogens which factory workers may get exposed in their working conditions. So these are all the risk factors which can increases the chances of getting a cancer disease.
Sir, could you please tell us the prevention of cancer?
Okay, so we have already see a look about the risk factors that can lead to the development of cancer. It is the prevention of exposure to these risk factors will help us in preventing the development of cancer. So as we have already seen, it is the avoidance of smoking, alcoholism, using of pan masalas, gutkhas, and also factory workers should use protective measures like masks and protective clothes. They should avoid direct contact with the chemicals that they are using in the factories. Also, avoiding heavy sunlight can also help us from acquiring a cancer disease. So, other than this, there are a few vaccines are available to protect us from cancer. So, the vaccines are not available for all the cancers, but a few cancers are having cancer vaccines. So, for example, a human papilloma virus vaccine like a Cervarix and Gardasil, which can help us to protect us from cancers such as cervical cancer, vaginal cancer, anal cancer, and also in some types of oropharyngeal cancers. Vaccines like hepatitis B virus vaccine can help us to protect from liver cancers.
Sir, treatment for cancer.
So the basic pillars for the treatment of cancer is oncosurgery, radiation therapy, and chemotherapy. Nowadays, other than these basic treatments, we are having some newer techniques for the treatment of cancer like hormonal therapy, targeted therapy, and also immunotherapy. So all these treatment modalities can be used in the treatment of a cancer patient. For most of the patient, for 99% of the patient, more than one treatment type is used. Means the cancer will be treated by a multi-modality therapy than by using a single modality of treatment. So most of the patient will require a treatment by a surgical oncologist, medical oncologist, and also by a radiation oncologist.
Sir, what are the types of cancer?
So there are numerous types of cancer. We cannot able to list all the types of cancer here. So even if you consider a breast cancer, even breast cancer is not a single disease. It contains multiple histological types as well as multiple morphological subtypes. So there are numerous types of cancer that can develop in our human body. So depending upon the type of cell in which the cancer arises, they can be classified as carcinomas, which arises from the epithelial cells, or sarcomas, which arises from the mesenchymal connective tissue cells, and lymphomas, which arises from the lymphoid tissues, and leukemias, which arises from the blood cells.
Sir, cancer can be cured?
Yes, definitely. So cancer is a curable disease. So the cure of cancer depends upon the stage in which the patient is diagnosed and the patient is in which stage the patient is treated. So in general, the cancer is divided into 4 stages: stage 1, 2, 3, and 4. It depends upon the spread of the disease. If the cancer cells spread from one part of the body to another distant part of the body, it is called as a metastatic disease, and which is a stage 4 disease. So the treatment and cure of a patient in a stage 4 disease is quite difficult, but the stage 1 and stage 2 and stage 3 diseases are called as the loco-regional disease, in which the complete cure of the disease is possible. For example, if we consider cervical cancer patients, the patients, and if we look at the 5-year survival data of these cervical cancer patient, the patient who are diagnosed and treated at a stage 1 disease will get a 5-year survival rate of about 90%. It means about 90% of the patient who got treated for a stage 1 cervical cancer is alive after the end of 5 years, at the end of 5 years. So the same rate is only 70% for stage 2 cervical cancer, and it is about 40% for stage 3 cervical cancer, and it is only 15% for stage 4 cervical cancer. So in case of a cancer, the complete cure of the disease depends upon the stage in which the patient is diagnosed and the treatment is started. So which implies that the early diagnosis is the key step in the successful treatment of a cancer.
Sir, cancer is hereditary disease?
No, as such, cancer is not most of the cancers, about 95% of the cancers are not hereditary disease. only a very few types of cancers are hereditary in nature. So if we can reframe the question like if a person is having cancer, whether their children's also have the chance of getting a cancer, if the question is claimed like that, then the answer is no. So cancer is, most of the cancer are not a hereditary disease. It cannot go from one generation to another generation.
So what types of cancer are hereditary, sir?
So few types of breast cancers and a few types of colon and endometrial cancers are hereditary, but they are very few in nature.
Sir, when we should get tested for cancer?
Okay, whenever a person develop a symptom related to a cancer disease, he should get himself tested with tested whether he is having cancer disease or not. So for this, we should have a good idea about what are the symptoms that a cancer disease can give rise to. So the general symptoms are, so whenever you are having a lump or a tumor development in any part of the body, and which is progressively increasing in size, and which is persisting for more than 3 weeks or 4 weeks, then you should definitely consult a doctor. And then other symptoms are persisting of pain for more than a month in any part of your body, or bleeding from your from any part of the body, like blood staining of saliva, vomiting of bloody vomiting, so bleeding per rectum, bleeding per vagina, blood staining of urine called as hematuria. So in all these conditions, you should get yourself tested for a cancer disease. Other than that, even cancer disease can give rise to a problem to our normal lifestyle, like difficulty in swallowing, pain during swallowing, difficulty in urination, or difficulty in defecation. So in all these situations, it's ideal to get tested for cancer disease. So other than this, patients who are symptom free and who are not having any symptoms pertaining to cancer can have some test called as a basic screening test. So some of the commonly used basic screening test are a pap smear test for a carcinoma of for identifying carcinoma of cervix, which is a simple outpatient procedure which can be done in 5 to 10 minutes. So which can help us in identify the cervical cancer at a very early stage. So other screening tests are a mammogram test for identifying a breast cancer patient, a CT scan test for patient who are taking a lot of smoking, so is having a long history of smoking, can take a CT scan of the chest for screening of for lung cancer, and some other test like a deduction of blood per rectum, so fecal occult blood test, and then a colonoscopy test can also be done for the detection of early detection of colon cancers.
Thank you, doctor, for your valuable comments and your inputs.
Thank you.